Achieving a balanced lifestyle doesn't have to be a dream, and wellness doesn't have to be an activity you save for downtime. Instead, elevate your personal and professional life with the tips, tools, and insights to holistically support healthier habits. Join me, Dr. Callie Davis, in the Mind-Body Connection for enlightening conversations, inquisitive panel discussions, and illuminating stories from experts in the medical and healing communities who are leading the movement toward a holistic approach to health. Hey everybody, we are joining together in an ongoing conversation that's really important to me and my mission. And it's all about answering the question, what the health is going on? We have some really serious problems in our healthcare system today. I serve patients every day who have spent many resources, their money and their time, on trying to find a diagnosis and treatment plan that could help them. And what I find, by and large, is a person who has not been listened to, who has not been seen as an individual, who has not been given the space and the time to really be considered as a unique case. And what we end up with a lot of times in our practice at Hands on Health is like these unsolved problems that are really complex and are not given enough time or care in the current healthcare system that we have. Now, there's many, many layers to this, right? So I want to be able to spend some time with you unpacking what are the causes behind this fiasco, this disaster that our current healthcare system has become. What made it happen? And then I also want to go through some solutions, some things that I see that can really take us to the next level in healthcare, bringing the care back into healthcare and ensuring that individuals get their needs met. And at the end of the day, that means that we are able to reclaim our health, that we're able to recover our function and our well-being. It doesn't mean that we're shuffled through this system point by point, spending our time and money and our valuable resources in order for the system to profit and to grow stronger and for us to be more disempowered as individuals. So let's go back a couple of decades. I began PT school in 2002 at LSU Health Sciences Center in New Orleans. I was 21. And I knew that I wanted to be a physical therapist. And I knew that in my heart, in my core, I wanted to help people. So I thought physical therapy was going to be a pretty good job. I knew I would be able to work individually with people who were recovering from injuries or healing or having pain. And so I embarked on this 2.5-year period of graduate school. I learned a lot. It was trial by fire in many cases. Like, we would have tons of lectures and exams and coursework, but then we would also go on clinical rotations for long periods of time. And it was in the beginning of my clinical rotations. This is where we go in the field and we work with other PTs and healthcare teams and doctors and nurses, and we really kind of get our feet on the ground, and we start to gain that practical experience of putting our knowledge to use. And the patterns that I began to observe very early on as a student of physical therapy were pretty negative. There were a lot of really dire situations that I witnessed in healthcare where I knew as a student that the patient's needs were not being put first. But instead, the needs of the healthcare organization, the system, or the profit was being put first. It was money-based decision-making. And I could see this from settings within the ICU, in the hospital, in acute care, in inpatient rehab. There were many cases, even as a beginner, that I would start to synthesize information about this patient and think, they don't need to go home yet. They're getting discharged too early. They're unsafe. They're a fall risk. The PT on the team would have to advocate for the patient to stay like one more night or 2 more nights in the hospital so that they could go home with more strength functionally at a more independent level so that they wouldn't fall and hurt themselves and land right back into the hospital again quickly. And so we were signing off on charts to discharge patients because basically their insurance plan would only cover so many nights in the hospital or so many services. And once they met that dollar cap, they were basically kicked out of the hospital, discharged to go home, whether or not they were independent, and regardless of whether they had any family to help them or not. Some of them were being discharged alone as complete safety risks. So very early in my career, I began to see the gaps. And it started to really not make any sense because here I am signing up for this very altruistic field of medical professionals in order to help people to improve their well-being. And what I was met with in reality is a system that doesn't serve the individual at all. It actually just overlooks the individual's needs in order to profit in the mainstream. And I had big issues with that from the beginning, but the older, more advanced, more experienced PTs in the system, it was kind of a culture of just look the other way, just do the work, just kind of be the cog in the machine, keep the job has good benefits, good pay, there's stability there, be a part of the system. If you wanted to speak out and not be a part of the system, then you didn't really belong there. There wasn't a place for you to advocate for patients' needs. And so I grew weary of that very quickly. But at the same time, I really enjoyed the hospital setting for a different reason, and that was because I was able to work hand in hand with teams. I had teams of physicians and nurses and wound care providers and people who were really experts at their skill level for taking care of patients. But at the end of every day, in the beginning of my career, when I had graduated, I was licensed, I was, out on the floors, working in the hospital, pulling my own load, I would come home crying and really broken because I witnessed people being treated just as numbers only. They were not valued as people. The decisions about their health care were being made by administrators who were looking at numbers. And they, the patients, really had no say-so in their own decision-making and their outcomes because they were reliant on their insurance companies to pay for their care. So they really didn't have a voice. I probably came home some nights crying just because I was really burnt out too. I had 15 patients a day to see, sometimes 20 patients a day. It varied. A low number for me in the hospital was probably around 13 a day. A high number would have been like 21, 22. And I would just come home dead tired. And above all, I knew that I had not really been able to help one person on my caseload because I had to be in and out of their room within like 15 minutes, maybe 20 minutes max, maybe 25 if they were in an ICU setting. And so it was very disenchanting because I put myself through a lot of hard work and education and training in order to come out into the system that actually was not providing healthcare for patients. So I made a career change to outpatient therapy, totally different setting. I was able to see 2 patients at a time. That meant like 2 patients an hour. So I got a little bit more hands-on time with them. And I began pursuing a lot more manual therapy skills, hands-on training, being able to manipulate soft tissues and joints and really work with them as a manual physical therapist. And my next challenge came up in that setting that I wanted to really just get my hands on my patients. I wanted to hear what their problems were. I wanted to spend the time with them, talking, listening, really figuring out with curiosity what their issues were and what their root problems were. And that took a lot of time. It took much more time than 30 minutes even. I would say over the years in my outpatient experience, I began to grow and learn a lot more as a PT because I was spending more minutes with my patients. So it really drove me to that higher level. I started to see better outcomes. I started to be able to enjoy and appreciate that connection with a person who needed my help and who I was able to deliver quality care to because I had some more time and it wasn't as much of a high quantity, low quality situation as acute care had been for me. And so I kept pursuing that path, but I still saw the gap. Many times, let's take the example of like a Medicare patient. Medicare patients have a certain cap of dollars to spend per year on their health care. They pay a premium every month, like an insurance premium. And then Medicare allots them a certain amount that they can expend in the healthcare system. So in the physical therapy world, this looks like this. Patient comes in, they had a hip replacement 6 weeks ago in the hospital. They're coming into outpatient therapy now. They're walking with a walker or a cane. They're getting around kind of independently. But they really need to work on strengthening, flexibility, balance, things like that, so they can restore their function fully. So Medicare says, okay, so you pay for Medicare insurance, and you're going to get about 12, maybe 15 visits for your problem. And those 12 to 15 visits with a PT end up looking like maybe 20 to 30 minutes with the therapist, if at all, maybe 20 to 30 minutes with a PT assistant or a PT technician. And let me tell you, PT technicians, while there are some wonderful techs out there, they do not require an educational degree. They do not require a vocational background or a license or anything. They're trained on the job. So they're kind of like they're going to do what they're directed to do. So you're paying this premium, you're coming into an outpatient physical therapy center, you're expecting to get better, and you may be seeing just about all of your minutes by a PT technician who's basically watching you do exercises. So it looks really like low quality. What are you receiving on the other end of that? You're going in and you're receiving very low skilled care. and you're coming out and you're wasting about 3 or 4 weeks of your time going to therapy 2 to 3 times a week for an hour to be able to sit on a bike for 10 minutes, walk on a treadmill for 10 minutes, do some stretches supervised by a tech, and maybe get some joint manipulation or massage from a PT, if you're lucky in a setting that allows the PT's hands-on time. Okay, so at the end of the 12 to 15 visits, your Medicare dollars are out for the year. Like, you can't tap back into that. That's an annual limit. And so what do you have? Well, maybe you're a little bit stronger. Maybe your scar tissue is healed a little bit more. You might still have some pain. You may still not be able to do the things you did before the hip surgery, like play with your grandkids or get up and down from the floor, take a bath independently. You might still be a fall risk. You may not be able to drive without pain. And you've spent all this time and money already paying into Medicare before all this happened, and then using your Medicare benefits in order to get very little from the time that you're spending. I'm trying to paint the picture for what it's like for so many Americans who deserve better and who we can do better for. We just need to start changing the way we see things. We need to start changing the way we deliver healthcare. So what the health is going on? We're going to continue the conversation. We have guests to join us to be able to weigh in on this conversation. Why is our healthcare system such a failure? What can we do to improve it? We are going to talk about our bodies, our lives, ourselves, our quality of living, and why our healthcare system is not working for us. Thanks for listening, and I want you to ask yourself, what the health is going on?